Hello class, welcome to Dental Radiology. My name is Whitney Roden and I am a dental hygienist. I am also your instructor. You should have a worksheet that you need to follow along with and fill out as you listen and learn. This is our activity for today. In this lesson, I will discuss the importance of dental x-rays in patient care. I will be focusing specifically on the bite wing x-ray. I will review the anatomical structures that are captured when taking a bite wing x-ray. I will point out common dental problems detected on a bite wing x-ray, and I will show you how to assemble a RIN device for taking bite wing x-rays, as well as proper technique and tips to capture a good bite wing x-ray. Did I say bite wing x-ray enough? Refer to your worksheet. Let's begin with why we need dental x-rays. What are they used for, and how do they help us? Understanding the use of dental x-rays for diagnosis and screening purposes is important as a clinician, but it is also important so that we can explain to our patients why we need to take them, because they are going to ask. Trust me. Dental x-rays are digital images of the hard structures in a mouth that are used to evaluate oral health. Low levels of radiation are used to capture images of the interior of the teeth and jawbone. They allow us to see the things we cannot see clinically. They aid us in detection of interproximal decay, also called a cavity that is between the teeth. We can see the bone levels, which help us with the diagnosis of periodontal disease. And we can see calculus or tartar, which is hardened bacteria that builds up on the sides of the teeth. These are important components to help us determine the proper care for our patients. I'm going to pull up some images of common dental problems diagnosed on dental bite wing x-rays. Here we see the darkness between the teeth. These are cavities. You can look at the circles, the blue circles, they'll show us the cavities between the teeth. These cavities are very small. Often the small cavities won't be seen clinically during an exam. They may or may not be giving the patient sensitivity or pain, and often a dental x-ray is the only way to detect these cavities. Because of dental x-rays, a treatment plan option to repair the tooth can be given to the patient before they have discomfort. If you look at the decay in the images with the arrows, the decay here is quite large. These may be giving the patient pain. Either way, cavities are detected easily on an x-ray. When looking at bite wing x-rays to detect decay, it is important to open the contacts and not have any overlapping in the image. I will demonstrate how to do that here in a bit. If there is overlap, then it makes it difficult to see the cavity between the teeth due to the obscured view. If you look at this image here, we can see there's a cavity, it appears, between 30 and 31. If we were to have another view of this person where we opened up the contact between 30 and 31 in a molar view, we would probably be able to determine more accurately that there is decay there. That's one of the reasons why it is important that we take 4 bite wing x-rays so that we have another view that could reveal decay that was not seen due to the angulation or the overlap in the other x-ray. We're going to look at these bite wing images and talk about the structures that we're trying to capture when taking a good bite wing x-ray. On a premolar view, we're trying to get the maxillary and the mandibular canine in the image. We're trying to get the distal of that canine in the image. We're also trying to open the contacts, and we're trying to get the bone levels of both the max and the mandibular jaw in the image. If you look at the left one, they did a good job of opening the contacts. They got the bone levels, but they didn't quite get that mandibular canine in the image too much. On the right side, though, however, they did a great job of getting both the max and mandibular canine, the distal of those canines, in the image. They opened the contacts and the bone levels are showing. On the molar view, they opened the contacts. They have the bone levels showing, but one thing we're looking for is 2 millimeters past the second or farthest back molar in the mouth. On the right side, they didn't quite get back behind that last molar enough, and you can't really see what's going on there in the image. On the left side, they did a great job of getting a few millimeters behind the distal of the last molar in the mouth. So on the set of x-rays here, the left side molar is a great view, and the right side premolar is a good x-ray. Okay, in this next image, it is a bite wing. We've just zoomed in on the second and first and second molar on the mandible, number 30 and 31, and number 29, to explain in detail some of the structures that makes up a tooth. And so the blue arrows are pointing here. We can see that the pulp is the nerve and blood vessels. It supplies the tooth with a sensation, it feels sensitivity and pain. It innervates it with the nerve and the blood. If the pulp is damaged, it's when you need a root canal. The next layer would be the dentin, and that's a softer layer that is part of what makes up a majority of the tooth structure, but it is still protecting the tooth, but it is softer. The hard structure around the outside is the white that you see in the image, and you can see the blue arrow pointing to it. That's enamel. Enamel is one of the strongest structures in our body, and that's why I often refer to it as the armor that protects the tooth. When bacteria tries to cause a cavity, it penetrates down the sides or the top of the enamel, and if it breaks through that enamel and gets into the dentin, then they need a filling or some kind of restoration to repair the tooth, depending on the size of the decay. If that cavity, is not, or that bacteria doesn't break through the enamel, it can sometimes cause what we refer to as an incipient cavity, or incipient decay, meaning that it hasn't gotten all the way through that armor, it hasn't penetrated all the way through. And we can see those often on x-rays, and we tend to just watch those and monitor them. But if the decay is, the bacteria breaks through the enamel and causes an actual cavity to get into the dentin, again, a restoration is needed. What I try to do when I'm explaining this to a patient is I refer to the tooth as an M&M. So that hard candy outer shell is the enamel, and the milk chocolate is the dentin. And if the bacteria gets through that hard candy outer shell and into the milk chocolate, we can just imagine it's just going to take off, and it needs a restoration pretty quickly. So that is a good way for a patient to visualize the anatomy of the tooth. You can also see the bone and the tartar, which we're about to get into those structures here next. Alright, in this bite wing x-ray we can see calculus or tartar. I use those words interchangeably, but they basically mean hardened bacteria or hardened plaque. So the plaque sat on the side of the tooth long enough that it calcified and is stuck on the side of these teeth. This tartar is subgingival, meaning it's below the gum line. And when we can pick it up on a dental image, it usually means that it's pretty large and it's probably been there for a little while. It can be associated with bone loss, which we can see a little bit of that happening there between 30 and 31, and even there a little bit between 3 and 4. And you can see in the red circles that have also circled tartar between 29 and 30. I see a little tartar also on the mesial of 4 and then the mesial of 29 as well, and those weren't circled. When this tartar shows up on an x-ray and it's large like this, it's been there a while, it's tenacious, it can be very difficult to remove, and with the bone loss, meaning it's probably causing some periodontal disease. But that's why we take images, and then we also do a clinical exam, because we cannot diagnose disease with x-rays alone. But the x-rays are very useful in helping us to determine bone levels. We would not be able to do that without them. We can detect the calculus, but this is a great way to educate the patient and also to know exactly where that tartar is, so we're not going at it blindly so much. In this next image, we see some more tartar. It's circled in blue, just another example. And then this next image is some pretty significant tartar. We sometimes call these spurs. I use the term tartar and calculus interchangeably, and like I said, we reference it as deposits, barnacles, spurs that we see on these radiographs. If you look between, what would that be, 19 and 20, there's vertical bone loss. You can see how it's going down the side of the mesial of 19. And then there's horizontal bone loss on the maxilla, there between, 12, 13, 13, 14, 14, 15. And we see those vertical defects on the mandible. So that's the difference there between horizontal bone loss and vertical bone loss. Now we look here at this image. It's going to show us the bone loss due to periodontal disease, and you can see the red line just really showing you that significant amount of bone that's missing along the tooth, and there's even a furcation there on number 30, meaning that the bone loss, you can see the bone loss on the image between the roots of the tooth. And then the image on the right, there is a healthy level of bone with no loss. That's just a great example of the comparison. In this next bite wing, we're going to talk about restorations that we can see on a bite wing. There are many things that x-rays allow us to see. They are a window into our patient's health, and they are required for proper diagnosis and screening. This allows us to look at the anatomical structures, but also the existing dental work as well. So here on number 31, you can see that the patient has a root canal, and then they also have a crown. This looks like a porcelain fused to metal crown. And then the same with number 2, a porcelain fused to metal crown. And then on 29 and 30, they have some composite, like resin type filling material that's been placed. So you can see the restorations and check the health of those with bite wing images as well. Today I'm going to demonstrate to you how to take a bite wing x-ray. I would like to start off by saying first that taking a quality bite wing x-ray is crucial for accurate detection and observation of the teeth and the bone. I emphasize quality because a poor image can allow for missed issues that can affect the patient's health. It is important to understand what structures need to be in the image so that you can place the sensor and the x-ray tube or aiming cone of the x-ray machine appropriately. Let's go ahead and set up to take a bite wing x-ray. When we take a bite wing, we use the red portion of the RIN device. Let's set that up now. I'm going to show you how to assemble. When setting up an x-ray, I use the acronym BAR to remember the order of setup. B is for bite tab, A is for arm, and R is for ring. I like to imagine that the B is the whale tail sticking out of the water. And then this arm is the body of the whale. So I stick the red portion of the RIN device into the bite tab. So my whale tail is sticking out of the water, my body is here, and then I stick the head of the whale, which would be the ring, in the small hole of the red portion of the RIN device. B, A, R, and I have my whale, and I'm ready to take my bite wing x-ray. Okay, I've got my digital sensor here, and we're getting ready to take our bite wings in our patient's mouth now. So I've covered my sensor so that I can stick it in their mouth. And then I place the bite tab around the sensor like this. All right, now I like to wrap my cord around the arm of the RIN device to keep it out of the way. All right, so we're going to place it in the patient's mouth now. When I'm placing my bite wing into the patient's mouth, I like to place it into the center of the mouth
If they have mandibular tori or palatal tori, or they have a very narrow arch, this can be challenging. So just do your best. So I'm going to have the patient open wide, and I'm going to stick this between their teeth and their tongue. I like to tell them this is going to go between your teeth and your tongue, and I'm trying to go as far forward as I can. I'm trying to capture the distal of the canine in this image. So I'm going to try to angle the x-ray actually all the way quite a bit over to where even the front of the sensor might be touching the canine on the other side. That way I can access and see the distal of that canine. And then I'm going to tell the patient to go ahead and bite down on that bite tab. And what I'm looking for here, I want to have them, sometimes I'll just tell them to smile like she's doing so that I can really see if my sensor is capturing the distal of the canine. And then I get my ring as close to the cheek as I can, because you want the closer the x-ray beam is and the cone is to the sensor, the more clear the image will be. Now I'm going to try to do something also where my sensor and the teeth are parallel. And the beam, if you imagine a central ray coming out of this x-ray cone and lining it up, I'm actually trying to line it up, not necessarily with the ring. I'm thinking about this coming in perpendicular to the sensor. And I'm having the sensor and her teeth be parallel. This is called the paralleling technique. That'll allow me to open those contacts and to capture the image the way that I would like. Here we go. Thank you.
Break down the paralleling technique a little bit for you. I know we just demonstrated it in the x-ray video that I just did, but when we're taking a bite wing or even a PA, which is a periapical, what you're trying to do is not elongate the tooth or foreshorten the tooth, like make it longer or shorter. You want to try to catch the actual size of the tooth in the image. And we do this by the paralleling technique. So we want the film, or it says film on there, but in this case sensor, to be next to the tooth, but not necessarily touching the tooth or right next to the tooth, but just parallel, meaning exactly lined up with the long axis of the tooth. As you can see in this image, the sensor and the long axis are exactly in line with each other. They're parallel, like railroad tracks. And then the beam, the central beam, is coming out of the tube. It's clear, we can't see it, but you have to imagine this straight line coming out, and it's going to cross through the tooth, through the long axis of the teeth, and then, perpendicular, it crosses through, and then of course hits the sensor perpendicular. So you get that paralleling technique, which gives you the most accurate image. There you go.
All right, here is the image that I just took. I got the distal of the canines and I opened up the contacts. There's a slight amount of overlap, but when I get the molar image, I would make sure that these contacts are open, but I did get the distal of the canine in this image. All right, for the next bite wing, we're going to get the molar image. I'm going to again try to set this in the middle of the patient's mouth. Sometimes I'll use their midline to line the sensor up, and I want to gently push their tongue over so the patient knows I'm going to be placing this between your tongue and your teeth. And I'm going back a little farther with this. So again, I want to make sure that I can see the sensor is at least 2 millimeters behind the last molar in the patient's mouth. And then I'm going to tell the patient to go ahead and bite together. There you go. And I'll have them smile again, showing me their teeth so that I can see where my sensor is. And then we're going to do the paralleling technique again, where the sensor and the teeth are parallel and my central ray is perpendicular to the sensor and the long axis of the teeth. Okay, here's the image that I've just taken. As you can see, I've opened up the contacts of this premolars and the molar, so we can see really nicely between the teeth. I can see the bone levels, which is another thing that we're trying to make sure we capture in the image. I'm also 2 millimeters behind the last molar in the patient's mouth. This is a wisdom tooth. We're not going to count that it's impacted, but 2 millimeters behind the last molar in their mouth is what we're trying to capture in the molar image.
Here we're going to demonstrate how to take a bite wing using a dexter. I'm going to stick the sensor in the middle of the mouth, trying to be parallel with the long axis of the tooth. I'm going to line my cone up so that the central ray, or this line going through the center of the cone, is perpendicular to the sensor and the long axis of the teeth. Trying to open up that contact between the premolar and the molar and get the distal of the canine. For the molar view, I'm trying to open the contact between the first and the second molar. So I'm going to line my cone up with the second and first molar, using this line in my cone to aim for that first molar. I want to keep the sensor perpendicular to my central ray, but parallel to the long axis of the teeth. Putting it in the center of the mouth, I'm trying to capture the distal of the second premolar and 2 millimeters distal of the last molar in the mouth. I line my central ray to be perpendicular with the sensor. Here are a few more tips from taking bite wings. We're going to keep the cone close to the patient so that it's easy to access it and the patient doesn't have to hold the sensor in their mouth for a long period of time. We want to use a number 2 sensor. We want to put the distal portion of the sensor up as close to the canine as you can get. I want to place it in the center of the mouth. And one way to try to keep your central beam going perpendicular with the sensor is you can line it up with the bite tab. That's a great way to ensure that you're right through the middle of that sensor.
Now that you've taken your bite wings and you know that you've captured all the necessary structures, the contacts between the teeth are open, the bone levels are visible, you've successfully gotten the distal of the canine, and you've gotten 2 millimeters past the second molar in the patient's mouth, then you know you've taken a good bite wing x-ray. Now get out there and practice. Taking a good bite wing x-ray takes time to master, and each patient will present with different challenges. Good luck, and thank you for watching my lesson on taking bite wings in dental radiology.
Okay, well, thank you for watching my lesson today. We're going to go over the activity that you were doing while you were listening and learning, and that would be the worksheet. So let's go through that and make sure that you got the correct answers.
So number 1, what is the name of the instructor? And that would be me, and I mentioned at the beginning of this class, it was Whitney Roden. And then number 2, what is the name of this class? This is dental radiology. And number 3, what type of x-ray is the lesson about? We really focused on bite wings during this lesson, and I mentioned it several times at the beginning. And of course we were talking about bite wings this whole time. Number 4, list at least one anatomical structure a bite wing x-ray should help us to see. The hard structures in the mouth. A bite wing can show us the teeth, and it can show us the bone. It doesn't show us any soft tissues usually. And number 5, why is it important not to have overlapping of the teeth in a bite wing x-ray? Well, for detection of decay was the main reason we really talked about. And then just to not obscure the view. So if we're trying to detect a cavity and there is an overlap, it's really hard to determine 100% that it's a cavity because the view is obscured. And number 6, true or false, calculus can be detected on a bite wing x-ray. True. We talked about that several times, pointed out some images that showed calculus. Of course, you still need to go back through and clinically check, but it's nice to reference back to the bite wing when you're also checking in the mouth to see the calculus. We use x-rays often too after we've cleaned the tartar off. We'll take another x-ray and see if it's still there. Number 7, what are 2 types of bone loss? Vertical and horizontal. We showed a great image in the lesson showing us the vertical defect along the side of the tooth, and then horizontal affects several teeth all the way across. And then what is something that the bite wings help us to diagnose? Decay, we've talked about, and then bone loss, several times we talked about. And then one time we were mentioning in there the health of restoration. So mostly like crowns and fillings, where we can see the edges of the margins of those restorations to make sure that they're healthy, they're holding up, they're not leaking, they're not open, and that they look good, so we can feel good about letting the patient keep that restoration. Number 9, what is the acronym used to help us remember how to assemble a RIN device, and what does it stand for? The acronym is BAR. B is for bite tab, A is for arm, and R is for ring. Number 10, what needs to be perpendicular to the teeth and the sensor when taking a bite wing x-ray? Well, the x-ray cone, or like the central beam that runs through the x-ray cone, needs to be perpendicular. Number 11, what is the technique called when the sensor and the teeth are parallel when taking a bite wing x-ray? It's called the paralleling technique. Number 12, what part of the canine must be present in the image of a premolar bite wing? The distal. Number 13, which molar must have 2 millimeters past the distal of it in a molar bite wing? Well, the last molar in the mouth. And that's kind of a trick question because a lot of times you want to say the second molar, but somebody might be missing the second molar, or they might have a third molar, and then it would be 2 millimeters past the third molar. So no matter what, it's behind the last molar. And then number 14, why do we take 4 bite wing images on an adult and not just 2? The main reason we do that is so that we can see all of the structures. We want to be able to open the contacts on the premolars and the molars, see the distal of the canines, and see 2 millimeters past the distal of the molar, the last molar. We want to see those bone levels. When we're taking bite wings, we're looking at the posterior teeth and capturing all of those structures. So by taking 2 images, you can do that well. All right, last question, number 15. How can a clinician learn to take good bite wing x-rays? Well, practice, of course. Practice makes perfect. Get out there and do it. All right. Well, thank you so much for taking my class. I hope you learned a lot today about dental bite wings.